When you're preparing for physical exam and procedures, it's important that you introduce yourself to the patient and family and explain what you're going to be doing. You can observe the patient's behaviors before even talking or touching them, giving them time to adapt to you. It's helpful to inform them what's going to happen and in what order. You can utilize identified calming objects from the reach box. You can use timers, counting, or statements such as first we will do this and next we will do this. One way to use a timer would be on your cell phone. And simply counting to 5 or any other number over and over again to let them know that the procedure will end at the end of that time limit. Give the patient choices. Allow the patient to touch the medical equipment. Beginning the exam with their hands or feet, then moving centrally, is often helpful to prevent defensiveness. You want to use your reach box to provide rewards or incentives for desired behaviors. When you're planning for a procedure, it's very important to find out the patient's typical stress reaction, such as aggression, self-injury, or flight. Then you want to proceed to make a plan. You want to ensure that you have the right amount of associates in the room to help if needed. You want to prepare the environment to make it safe. You want to move in a coordinated fashion. And most importantly, you want to use one voice. One voice means that only one person is talking to the patient at a time. Oftentimes, patients can become overwhelmed by multiple people talking and attempting to calm them who have the best intentions, but overall, that might be overstimulating. And if you have Child Life in your area, consult them right away and include them in the preparation and throughout the procedure. There's times during procedures that you might have to change course. If the results are not clinically essential, and if you have insufficient staff or equipment, or if you're starting to see escalation of aggression or agitation, or if the associate or patient safety is in jeopardy, it is okay to have an open dialogue with the provider about the situation at hand and what could be done to accommodate. Signs of anxiety include an overall nervousness, restlessness, breathing faster or hyperventilating, tachycardia, running away, hiding, crying, maybe an increase in motor tics such as facial twitches, blinking, neck movements, or sometimes just repetitive questioning of the plan. Oftentimes you'll see that higher functioning children with autism might just simply start to ask over and over again what will happen and when, and that could be a sign of their anxiety building. Signs of agitation include irritability, anger, maybe their voice or sounds are getting louder. They're more aggressive, maybe hurting themselves or others. They might start throwing objects, biting, or even proceed into a severe tantrum. Some in-hospital resources that are available include Child Life, who you should contact early to help with assessment, patient coping, distraction, and setting up the environment. Social work can help with family resources and other care coordination. ERNIE resource is available when preventive efforts have failed and the patient is starting to escalate. A code BERT is when the patient's safety or associate safety is at risk and you need associates to help right away. If you have any questions about the REACH program, you can contact the Child Life Department, you can contact myself, or Kimberly Zalewski. You can also email reach@nemours.org.